which muscles am I going to stretch, which muscle I'm going to shorten passively. So which muscle I'm going to stretch right now? From rotator cuff muscle.
Is that the infraspinatus?
So if infraspinatus, that's what see. There's actually left shoulder, which is this. Okay. So what's this?
That's the tuberosities or whatever.
Yeah, and those the blue sides.
From there, the muscles.
This is attachment of the muscle.
Yes.
Okay. Actually, this is insertion of those muscles.
Yes.
And what muscles are we talking about? S-I-T. That's why you call it sit muscles.
Yes.
You heard about sit
Yes.
muscles.
Yes.
This is arrangement of insertion of the muscles. And sit stands for what?
That's the supraspinatus,
Infraspinatus,
and
teres minor.
teres minor.
Major. Good. I mean
The
minor.
minor.
Good.
Minor.
Teres minor. And that's the three muscles that
Yes.
create sit muscles.
Yes.
Now this one is what?
Subscapular.
No.
Good. Because you just realized that's the subscapularis attachment. So now when I'm going with this movement, which muscle I'm going to stretch now?
That's the subscapularis. That's what I said, no?
But you said what?
I said subscapularis.
You said
Infraspinatus.
I did? Oh, I meant
That's
to say
just
subscapularis.
try
I meant to
try
say.
to see that kind of visualize that what you're doing, right? So all those three sit muscles going to be shortened, but subscapular is going to be stretched. Then right here, I'm going to stretch supraspinatus, infraspinatus, teres minor.
Yes.
We're going to stretch right here, and subscapular is going to be shortened. The shortened passively is also kind of important to know because there are techniques based on this that you position the body shortening passively the muscle. It's not only about muscles but also about information of shoulder condition. Like maybe some of you heard already or you heard here about frozen shoulder condition.
I just read there something about
Okay, adhesive capsulitis,
Yes.
more medical, or subacromial bursitis. Those conditions gonna restrict motion. Now, when you're gonna go this way, it's gonna be more painful than this way. This is subacromial bursitis. But when you're gonna go this way, it's gonna be more painful than this way. It's gonna be frozen shoulder. So, if you know this, that might even help you to realize what condition you're working on. So those techniques, like I mentioned before, they are therapeutic but also diagnostic technique. So you go right here, so it's painful. So okay, they might not tell you even that they have some problem, or but they might not know. So you're gonna know more. Okay. So again, first, second. And different amplitude, a little bit play with that. Not like this. Sometimes people go,
Just like
this is not the way you want to push it and let it go.
Okay, so now she tells me that, oh, that's painful. So then how
So
I
you
check
go-
where...
So
okay,
you go
I
right
know
here.
where-
Is that painful?
Yes.
Yeah, it's more painful. How about this one? Yeah, I feel
So
something,
now I
but it's not
know
like
which
that.
muscle to work, the one
Which
to
muscle,
stretch
or if there is a problem with joint too.
it. Yes, yes, yes.
And there's another way that you check if it's muscle or ligaments and
I
capsules.
understand.
Okay? So we're going to talk about all this. And then, and go with you just let go of it. Okay? Then we're going to go right
那你的录吧，
here.
不要按啊，
Traction.
不要按啊。
Now, pay attention also to my body mechanics, how I use my own body. I'm not standing like this and pulling this way. I'm shifting my weight. Okay? I'm going to go to this. most commonly, I'm gonna stand like this, or like this. This, like you massage someone. That's the stance you should have. Don't stand too long like that. You might, of course, but this is much more comfortable for your lower back, actually.
Yes.
So when you stand like that too long, you put stress on both sides of lower back, and they're gonna start to get muscle. When you go like that, on the one side is more working, but it's not even the same like before. And then when you're gonna switch, for example, right here, you switch it. It's the same as what we do, very natural way. When you wait for the bus, for example, you stand one leg.
Yeah,
And then very natural, not even
Yes.
thinking about it, your body's gonna move you to the other leg. Okay, you don't stand 20 minutes or 30 minutes one leg. Or you don't stand on both legs like that. Okay, that means that your
It
body
makes
naturally gives you signs. Okay, so you're right here now. I lock the fingers with my thigh, and I just go and play. So all those techniques are relaxation technique. Of course, you can just incorporate it with massage, adjusting,
number
whatever
6.
you want to do. Okay? Work on the elbow a little bit, whatever, but you go right here first. And before was traction. Traction, which is this, and this is already joint play techniques and arthrokinetic movement. So we incorporated it. Then I'm going to grab the arm right here and stand this way. So I always stand towards feet. And I can see that we don't have bolster. How did we prepare everything with no
Yes.
bolster? Always put the bolster unless the person is going to say, I don't want a bolster. Some people are weird and they don't want a bolster. Why bolster is important?
For the lower back, no?
Yeah, because that release tension
Yes.
and that the whole soft tissue and fascia on that side that
To the
is
left.
stress on the lower back. So now you go right here and you stand this way. Remember, don't work when you want to move arms this way. Don't work sideways. Always this way. See what I'm doing now? When I move my body on my leg, not moving my arm, I move her arm. So that's the idea. I don't want to stand like this and move my arm like that. Okay? I want to do it this way. But now, before we're going to do it, we're going to grab the
你去那边录了，我
joint
看
and
不见了
go
这里
up。and down. Okay? And that-
去那边录。
So I'm going with elbow down and pushing joint up.
站在这边。
When you go up with the elbow, I'm pushing down. So that's a two-way action movement. Hmm? That's what it is. Here, here, here. Hmm?
他不会跑到门口那边去的吗？或者他那边
Flat fingers, not like that.
这里
That's going to be painful.
走那边的，他的脚那边。
And then I'm going to go, so now I'm affecting what, posterior ligament,
看得见。
okay, and anterior ligament. Posterior, anterior, posterior, anterior. And then I'm going with circumduction, small circumduction. So that's affecting the whole ligament and capsule around, both directions. Small movement. Can go also this way. You don't have that, but it's just two-way action. You push it this way, like that. So I move that in effect inferior part of the joint. We don't go too much this way, although we might. But first of all, this is endangerment side. You want to push on that, and this is acromion that's going to stop the movement, so you can go this direction. That's why dislocation of shoulder doesn't occur superiorly, more posteriorly or inferiorly. So again, up and down, then small circumduction, both directions.
那边
From
没有
that,
特别
we're
清楚，
going
你
to
自己
go
看
on。deltoid. You have it probably upper trapezius.
We have
and then deltoid. Yeah, but I want to go on deltoid first. Because it's from here you go on deltoid muscle. Slightly bigger circumduction, and you manipulate the deltoid going up and down. See, and I'm going this way. See, I don't have to look at that. I'm going like that. And then opposite direction. Because circumduction is what? Up and down. Up
Just the
and
rotation.
down. And we go with the hand braking. Now I'm going to switch the directions. I'm going to go opposite direction. Slightly bigger movement than before. On joint play techniques, we don't want to do big movement. Then I'm going to go abduction and adduction. Abduction and adduction. And at the same time, fully. Fully. Abduction, adduction, fully. So my hands going one away from another.
你来 hold 我看看我
I'm
们
not
机器怎么
standing like this.
对对
See? I'm shifting my weight forward back. So my arm doesn't work at all. If I would go from this side here, see that's where, see my arm's hanging here, I move her arm. And pulling. Pulling is a technique you grab the muscle closer to the deltoid tuberosity, which is insertion, and you move along the muscle all the way to acromion process. Peel the muscle. Don't push against it. You grab and peel the muscle off the bone. Make the space for fluids. It's the same like I will do this. See, and I make a tunnel over there. I go like that, I make a bit bigger tunnel right here.